Hi, I'm Miguel Delgado, board-certified plastic surgeon, and I want to talk about a combination procedure of a Brazilian butt lift and a tummy tuck being done simultaneously. It's a fairly complex procedure when it is combined because patients can't sit on their buttocks and they're bent over from a tummy tuck. So you have to pick the patient extremely carefully, and you have to explain this very carefully to them post-operatively what's involved in the recovery. The surgery is fairly straightforward. It's the recovery which is the more complicated thing. With a combination procedure, Brazilian butt lift and tummy tuck, we take fat from the skin that's being removed from the abdominoplasty, your waist, your back, your legs. We take it from a variety of places to make sure that we have enough. And some patients we don't. So we put in what we have. I'd like to have at least 500 to 1,000 cc's of fat per buttock is what my goal is, and that's what I like to see, and that gives you a significant increase. Depending on the person's frame, how large the frame is, you'll need more fat. The smaller frames, you need less fat. The Brazilian butt lift technique of putting in the fat does not take long. You build the frame of the buttocks first, the height of the butt, the width of the butt, the fullness at the bottom, and then you place it in the center for the projection of the butt. This really doesn't take a long time, but taking the fat, getting the fat is what really takes the bulk of the time. Once that's done, we turn the patient over, we place them on a donut, and the tummy tuck procedure is performed in the standard fashion of an incision from hip to hip, undermining up to the rib cage, tightening up the abdominal wall that's been stretched from having kids. The skin from the belly button to the pubic area is cut out completely, and that skin now is pulled all the way down to the pubic area. So you can imagine how tight that is and how bent over you are as well. With these two techniques, there's garments that are worn for about 6 weeks. You can probably get around at about the 2-week time frame, but you're probably not driving for probably about 3 weeks, and you're probably not working white collar work for probably about 3 weeks, the end of 3 weeks as well. You can start working out at 6 weeks, but it takes you about 3 months to really feel great, very active, getting back to most activities in a very aggressive fashion. And then it takes a total of 6 months to really feel good about it, forget you had it, and start to really enjoy your new look. So the combined procedure is not for everyone. We pick our patients very carefully if they're a good candidate and if they can handle the recovery and be compliant as patients is very important. If you do those things, you'll be very happy with the outcome. You'll be flat, tight, nice waist, and a nice curvature buttocks as well. So pick your plastic surgeon carefully. Look at before and after pictures. Make sure he's board certified and look at reviews as well. Thank you very much. So Wendy, when you first came in here, one of the issues was that you didn't have enough fat on you, and that's not uncommon for a lot of people. And you went back and you gained 20 pounds. Can you tell me what that was like for you?
The first week was fun. The first few days wasn't because I eat really healthy. So my body, like I personally thought, yay, I get to have Frappuccinos, I get to have Frosties, I get to eat fast food. but my body didn't like that, you know, because when you're eating healthy, your body's like,
It's not used to it.
yeah. But
Yeah.
it was fun for the first couple weeks, but then you get sick of that. I was
Uh-huh.
like, I can't wait to go back to just eating greens and
Yeah.
eating protein and fish and chicken, which I had that too, but not as much at all.
Yeah. That 20-pound weight gain, how did it change your body? Where did most of the fat go?
Well, it's kind of like all in my like arms, boobs, belly. It never goes to my buns, which is why I
That's
want
interesting.
I know.
Yeah, can you explain to me what your goal is? I mean, you're having a tummy tuck, you're having a Brazilian butt lift and liposuction. What's your goal here? What do you want to achieve, and why?
Okay, so when I was pregnant with my daughter, I was 24, and so I gained 50 pounds with her. So I was 215 pounds when I gave birth to her. After 3 days, your boobs get engorged and all these things, and so I opted to get my breasts done 10 years ago.
Mm-hmm.
Well, I had to choose between the boobs or the belly because I had all that extra skin. Once you lose weight and get back to where you normally are, you know, you have all these excess things.
Absolutely.
Well, when I was 38, I decided I want to have the best body of my life by the time I'm 40, which I did. I got down to 130. My job is athletic. I mean, I do massage all day long, so I use every muscle in my body, so I was fit. And people tell me I look amazing. Look at your arms, look at your this, look at your that. But you know, when you get intimate with somebody or even alone, you know, or even in a bathing suit, there's things that you particularly pick out about yourself. You know, and for me, having to double tape my skin into my bathing suit is not cute. It's not, it's just always in the back of your head. So for me, I'm doing all the right things to be healthy and to have a good body and be in good shape. And I figure now's the time because, you know, as we get older, we have less of a bracket of time to enjoy those things.
Absolutely. I must say, when you first came in, you were pretty lean. You looked really good. I could tell that you were in shape and you worked out hard, and this 20-pound weight gain, I'm sure,
mentally it's
was not fun. Let's talk about, I mean, there's different shapes in the butt. You basically have a square shape right now, and we're going to transform that. What kind of, you sent me pictures of butts, which are all very attractive. Can you explain what kind of shape you would like to have?
Well, I kind of think of like when you cut a ball in half and you stick it side to side. If you look at the back side of a girl, it's like an upside down heart. So you got some shape here, then when you're side profile, you got some shape there. So I just want some shape, you know. Absolutely.
And there are various shapes that women come in with. There's basically 4 shapes. You have one of the better shapes to work with, you know, actually. So I think you'll do well from the fact that you have gained the weight, you have adequate amount of fat. The challenge for you is going to be, you know, dealing with the tummy tuck as well. And we've done a lot of planning to, you know, help you accomplish that. So why don't we go on to marking you, and I'd like to take some other pictures too.
Okay.
All right. So if we're going to mark you now, I think I'd like to start with your tummy first.
Okay.
So why don't you stand up and let's take off this gown, if I may, so I can look at the tummy first.
Sure.
Thank you. So now these underwear are where you like to keep the incision within, correct? Yeah. And you like the low rider look, right? So we're going to draw.
Are they perfectly aligned?
Yeah, why don't you look at them to make sure
well,
they're perfectly...
You look and see that the line is straight across. Oh, there's a mirror. Mirror on the wall.
Why don't you look at...
Yeah, that looks good.
Okay, are they low?
Yeah, that's good.
Okay. Because the thing is that once you put these, once we put our incision in, you can't change it, obviously. And so you're wanting to get everything within this line. So we're going to mark this Okay, well, why don't you sit down, and I'm going to lay you flat. So this is where the incision. So what we have here, this is her midline that goes from the sternum here to, actually the clitoris is the midline as well. So the belly button transects those 2 points. So we want to put her belly button on this line here, okay? The incision is low, the pubic bone is here, I can feel it. But the actual incision that I make is going to be lower because as you pull this up, the incision goes up. So that's why our incision is down lower. This takeoff here is about 70 degrees, and it falls within the underwear line out through here and out through here. So we're going to take off this much skin from this point here all the way down here. So all this is coming out. So you can imagine how tight that is. What I'm going to do now, this is her ribs right here, along here. And in surgery, what we'll do is we're going to undermine all the way up through here. We're going to sew her muscles together here, and that's pulling in her waist. And then liposuctioning all this here, and put it up down in your butt. You're going to look great. So her buttocks would be classified as a transition between a which goes out like this, and a square. So she's right between a transition between a and a square of buttocks. So we're going to clean out all of this very, very, very aggressively. This is the triangular point, and she's really bony here. She's got no fat, and this triangle, usually a lot of women have fat in this triangle, and you have to really extract the fat out to get a nice curvature. Now in her case, her iliac crest goes up to here, and her trochanter is right here, is right here, and this is her steep point right here. So her buttock have to be raised. Her buttock ends here. It needs to look like it's this high, because that's going to give her but the proper proportion. And then this steep point here is called, it needs to be brought out significantly, and this has to be brought out significantly as well. And that should be the ultimate projection of her buttocks. So this fullness should equal this fullness, and this fullness on both sides should be larger than up here. So this is her C point here. This needs to come out, be brought out like this. The buttock needs to be raised up to here on both sides. This portion filled out and rounded along here, and that is critical. Her outer thighs look good. We may want to take a little bit out here, in this area here. These dimples here will release these along here. Okay, so again, her buttocks muscle will be raised along this arc here to create more fullness and lengthen it, and then more width out through here. And once the frame is formed up here along the side, then we'll put volume in the center here. So the frame is what's important up front. Afterwards, you're going to feel tight, you're going to feel bent over, and you know, the buttock area will be you know, large, somewhat uncomfortable early on. So, you know, sleeping from side to side is going to be important. And using your pneumatic stockings when you're home to prevent blood clots, you know, is critically important too. So, you know, I'll give you my home phone number, my cell phone, so that it's easier to get in touch with me. So I think we're all set to go. All right. You'll do great.
Well, it's important to have a garment like this so that we're compressing, giving her some compression without being too constrictive. So we want there to be enough compression on the abdomen, but some room for where we're putting the fat, so that so it doesn't get smashed down once we put it in. But it's a garment made specifically for this procedure to make sure to hold all of this in place and let it kind of settle. But she has some good compression here without too much. We want blood flow to the area, so we don't want it to be too tight on her.
Hello.
Hello. How are you?
Good, how are you?
Putting a face to the voice from the night before.
Uh-huh.
Did you get any sleep last night?
I slept really good last night, actually.
Good. It's after that PB&J sandwich, huh?
I think because I went and got a good massage before.
Oh, nice. No allergies to any medicines or foods? And besides the breast augmentation, no problems with anesthesia now. It was about 10 years or so ago. Okay. You were asleep for that operation?
Yes.
Borrow your arm here. And no other medical problems on your active person with massage therapy, and no problems with your activity with chest pains or palpitations or a little bee sting right here, or asthma, wheezing. The only problem you had with your breathing was when you had that abscess, right?
Yep.
A little bee sting, burn. But otherwise, healthy young lady.
As far as I know.
It feels great. I don't feel any adenopathy. Head moves side, back and forth, okay? No stiffness.
Well, I have degenerative disc disease,
Right.
so I'm getting old there.
Yeah. Back, way back. Touch your chin, your chest. Yeah? Yeah. Deep breath. Good, go ahead and lie back. Just breathe regularly. Okay, everything looks good, sounds good. What's going to happen is Lori, your nurse, and I will come back in a couple of minutes. We're going to ask you what your name is and what procedure we are doing.
Okay.
Just make sure nothing has changed after your consultation with Dr. Delgado this morning.
Okay.
And after answering those questions, we'll walk into the operating room, and then she will prep you. She'll wash you from about your neck down to your knees.
Okay.
Then she'll have you get on the table, and your hands won't be prepped, so she'll instruct you how to get on the table and keeping the table sterile without using your hands. We'll get you positioned. At that time, I will come back in and I'll put monitors on, a blood pressure cuff on your arm, EKG pads, we were talking about that last night, to watch your heartbeat and your monitor on your chest, probe on your fingertip, and I'll give you some medicine through this which will make you go to sleep.
Okay.
when you're asleep, I'll put a breathing tube in the back of your mouth. After surgery, it comes out. When the operation is over, you'll wake up, stay in our recovery room for and probably a couple of hours. We'll watch you there. Position's gonna be an important thing because you won't be able to lie on your stomach or your butt, so we'll have to figure out probably going from the side to side. I'm sure Dr. Delgado.
I have a massage chair.
Oh,
I had
good.
it set up too, just in case.
You
that
got it all
works
set up
too.
and how to, yeah, all right. I tell everybody there are risks with surgery and risks with anesthesia. People have died under anesthesia. It's very, very rare. Anesthesia is very safe. We spoke about that last night on a phone interview. And I think you're in great shape to have this operation. You're a good candidate and everything should go well for you. Well, we just completed the pre-anesthesia consultation. We've gone over Wendy's past medical history, medications that she takes, allergies that she may or may not have, other medical problems that might be important for me to know, and also her history of how she has done in previous surgeries with other other operations, taking other medications and how she's done with them. I did a cursory physical examination. Wendy had an infection in her throat a couple of months ago, so I wanted to make sure that looked like it was healed and she was in good shape for today's operation. And everything looks great for Wendy, so I think she's an excellent candidate. So we've discussed what I'm going to do, her preparation going into the operating room, what she can expect, and what she can expect after surgery.